So let's go through these. The most likely test question you might get in glomerulonephritis will be probably about post-infectious GN. We have called this post-strep GN in the past. It's often due to strep, but it's not always due to strep. So now this is called more broadly post-infectious. It occurs in 5 to 15-year-olds, males a little bit more than females, and there's a lag between the infection and the renal manifestations. So it's 7 to 14 days after strep infections. Luckily, not every strep causes this, right? There are certain nephritogenic strains that can lead to the kidney disease later. But then the reason they've broadened the term is because bacterial, viral, parasitic infections can also lead to this picture. All right, I didn't put on here, but if you had impetigo, it's a much longer period, maybe up to 4 weeks or so before you get the renal manifestations. That's less common these days. So after the infection, you have abrupt onset of symptoms. Usually there's cola or tea-colored urine, some edema, high blood pressure, maybe with symptoms of high blood pressure, it can be severe, and the patient not feeling well, fatigue and malaise. And this is all happening because of inflammation within the glomerulus due to deposition of antibody-antigen complexes that are forming to that infection that happened. So you need time for that to all build up. That's why it's post-infectious. And trust me, this is a glomerulus. You have to trust me, there are tons of white blood cells and inflammatory cells choking this glomerulus, and that's what's causing all the symptomatology. So our lab findings will be that hematuria, often red cell casts, some proteinuria. This is one of the situations where there's lots of white blood cells in the urine. So if you have a picture like this and you see white cells, don't be tempted to say, oh, must be an infection. That's all that causes white cells. There are white cells in this condition for sure. The BUN and creatinine will be elevated variably. The C3 is low, the C4 is normal. And there may be evidence of a recent strep infection, but if you don't have that, you don't need that to be post-infectious. Lots of other things will cause post-infectious GN. Likewise, just getting a positive ASO doesn't give you a diagnosis. It just means you've had strep infection and you responded to it. So this is one of the kidney diseases that we don't jump into a kidney biopsy, we don't give immunosuppression. This immune complex reaction dies down with time naturally, so we do supportive care. So we use salt and fluid restriction. We may use some diuretics to get rid of the extra water. We use blood pressure medications, and luckily this is sort of a transient situation where a few weeks of medicine and we wean off. So you may have visible hematuria for a couple of weeks. The microscopic hematuria can linger for even a year or two. So that's important to know. C3 will normalize because the immune complex formation quells, and the proteinuria goes away usually within a month. So very good outcome disease to have.